Good evening and welcome to Relationships 101. My name is April Lancet and I'm a licensed marriage and family therapist. I am the director of the Salle University Marriage and Family Therapy Program. This is episode 2 of our Relationship 101 revival. We'll be talking to Professor Jazriel Turner about cultural humility, and what a wonderful time to have this conversation as it is Black History Month. And so let's begin with this deep conversation. Welcome, Professor Jazriel Turner. Before we get into this, let's have you introduce yourself to the world and tell them who you are and what's your background and what brings you to this work.
Okay. My name is Jazriel Turner. Like you said, I'm a licensed marriage and family therapist. I'm also an assistant professor at LaSalle in their marriage and family therapy program. And I have been doing therapy now for probably about 13 years. I've been teaching at LaSalle since 2021. And what brings me into this work, I think that was the question you asked, just a passion I've always had to want to help people and do therapy and do counseling. That's what brought me into the field, and then realizing I wanted to help future therapists and counselors, what really brought me into wanting to teach.
All right, thank you, Jazz. What about your background? Can you tell me a little bit about the populations that you serve?
Sure. So my background is that I worked in community mental health for some time. So working in community mental health, that's when you work for a community mental health agency. So you see a lot of different people, a lot of different backgrounds. The main individuals I worked with were transitional age youth from 18 to 25, and individuals who were struggling with anxiety, depression, trauma, just struggling with some mental health symptoms, relationship issues. I am a marriage and family therapist, so I'm always going to talk about and talk to individuals about relationship struggles. That was the bulk of my career, and then I went into university counseling, and then I went into private practice. So I do own my private practice where at this time the majority of my clients are young Black women who I see, and they're dealing with issues such as racial trauma, relationship issues, empowerment, boundaries, anxiety, a whole slew of different struggles that they are experiencing, and also just helping them strengthen and empower themselves as well. So that's the population I generally serve at this time.
Thank you, Professor Turner. And so I heard you say a little bit about your private practice. We'll get into that a little bit later. But we're here to talk about cultural humility. That's one of the newest terms that we find in our industry, and it's been making trends and news waves. So, can you share a little bit with the community what exactly is cultural humility?
Sure. So, cultural humility is such an important topic, it's such an important title, and it's something that I really like teaching my students about. I like being able to represent that in the therapy room as well. So, what cultural humility is, particularly from the therapist perspective, is the idea of I want to be open and provide a safe space to individuals, families, couples, coming into therapy. I want to be able to come from a place of not being an expert on who they are, their own identities, their own culture, their own values and worldview. So cultural humility is given that stance of I'm still going to learn about the individuals I serve. I can still learn about their identities, their intersectionality, and learn who they are. And it's not saying at any point do I feel like I'm an expert on where my clients come from and who they are and their backgrounds. And cultural humility is given that space for me to be able to have the knowledge that I'm not the expert, and have the knowledge that I can come from a place of curiosity, but I can still be able to open up the space that my clients could come in and know they're safe, whomever they are, whoever, what backgrounds they come from, and they're able to safe to be able to sit in my space with me as a therapist and therapy.
So, if I heard you correctly, it sounds like you are saying that cultural humility is coming as you are, coming to therapy as you are, not assuming that there is a power imbalance right away, but that that person is coming in and we're equals when we come into therapy. Is that, do I have that right?
Sure. So, in a sense, yes, because I would say that I like how you said that there's not a power dynamic right away, because there could be some power dynamic with the therapist and client. Unfortunately, it's already there. But it's being able to say not only are we equals, but I see you, and I want you to know that I see you, and I see all of who you are, and I want that to come into the room, and I have to be able to create that space for you. I feel as though that's speaking to exactly what culture humility is.
Could you give me an example of if a person came in and they wanted to learn about cultural humility from their perspective as a client, what would you say that you would tell them in a short way of explaining it to them?
Sure. I would be able to say, and I'm sorry, you said coming from the client's
Yeah,
perspective?
the
Okay.
client.
So if a client was to come in and they're seeing that, oh, Jazz Rael talked about being a therapist with cultural humility, my expectation is that that client comes in and they know that no matter who I am, if it's a different background than my therapist and who Jazz Rael is, or different identities than what Jazz Rael represents, that I can still come in as my full self and I can still be seen, I can still be heard, and I can still have a safe space. That it wouldn't be up to me to educate my therapist on who I am, all of my identities, but I can allow my therapist to make that space for me to share and bring in exactly who I am.
And what would be an example of something that a person might come to therapy and looking at it from a cultural humility lens?
That's a good question. So I would say a good example of that, I have so many in my mind, I'm just trying to bring it down to one.
Well,
A-
just take your time. No
sure.
rush.
A good example of that would be if a client wanted to come in and talk about something they might have heard in the workplace, something such as a microaggression, that's something they heard that might have been offensive towards them, and they said to themselves, I want to go to therapy, I want to talk about something that I heard that was offensive in the workplace. It wasn't directed towards me, but it was offensive. I heard it, I took it, and can my therapist be ready for that? Can my therapist be open to that? Because my therapist does not present how I present. My therapist does not share in my identities. So will I be able to truly talk about that? The idea of cultural humility for that client is being able to have a therapist that they know they can come in with that experience and be able to talk about that, even if that therapist doesn't identify the way in which they identify, look like them, but they know I can bring this to therapy and I'll be supported around it.
You mentioned a term, microaggression, and although I know you're a therapist and I'm a therapist, for those who at home who may not know what microaggressions are, do you think you could give us a simple definition of what a microaggression could be?
Absolutely. So a microaggression would be a subtle, whether it's a verbal form of a saying or a direct message that could be it could be a hint, it could be subtle. And sometimes people don't realize they're making microaggressions. Sometimes they do. Sometimes they have no idea, but it could be a generalized statement that could be said that's going to offend somebody, even if it's not in a direct way or indirect way, or the person that's making the microaggression or making this statement is not aware of, it still could be something that could be said, it could be something seen. There's a lot of different forms. Microaggression is the umbrella term, but it's a lot of different things that fall under it. It's different ways. But that would be my smallest breakdown of what a microaggression is.
Professor Turner. And I also heard you use the term intersectionality or intersectional. And so you and I might know that term. But for those who are at home who do not know what intersectionality is or intersectional, could you give a simple version of what that might mean to a person who does not know what that means?
Absolutely. So intersectionality is the idea of here are all my identities, and this is the way they could intersect, this is the way they could overlap, and this is the way they're going to impact me showing up who I am. So for myself, just to make an example, I don't mind being personal, and my intersectionality and my social locations, which is the identity of myself, I identify as a heterosexual Black woman. That's just some of my identities, but coming in knowing that this is who I am, this is how I show up in a space, and intersectionality is going to be those different identities in a way in which they intersect. And there's several other, but I'm not going to sit here and share all my identities. I would be proud to, but we don't have that type of time to go into all of that.
Sure. So if I heard you correctly, when we look at intersectional or intersectionality in treatment, we might be looking at race, class, gender, sexuality, ableism, and ableism.
Absolutely.
We'll be looking at all of those things under the umbrella if a
Absolutely.
client came to see us for therapy.
Yes, and that's a good question, because we, in cultural humility, we should be looking at all those things under umbrella, and also being able to, just like your question, support our clients with how those identities impact them. So maybe they've never heard the term intersectionality or cultural humility, but being able to support them with, these are your identities and these are ways in which you show up in the world just based off of your identities and how you can be impacted Each of those identities can carry some level of privilege. Each of those identities can carry some level of marginalization or oppressive identities as well.
You didn't spoke the word privilege. I know you mentioned power, and so in the context of therapy, how could privilege or power show up in the space with a client and
It's a very good
therapist?
question. I would say one of the ways in which privilege could show up with the client in therapy is just the identity of being a therapist and the client being a client. If I show up in this space as an expert, that I know better of my client's life than they know for themselves, that I know better than their experience than they know for themselves. I feel as though that's the way privilege and power could show up in the therapeutic space, off of the therapist side for sure. That's just one of the ways I feel as though it could show up for sure.
And what about power? That's a big one.
Yeah, no, power is a big one. I think asserting that privilege, I guess I'm using the same terms, but asserting that privilege, being able to be in a space and with my client where I'm trying to assert my privilege of being a therapist.
Because you could be the voice in their head,
I
right?
could be the voice in their head. I could being able to really, really push that and push my own agenda on them. Being able to really, really push my own agenda and again, not creating that safe space for them. Yeah.
Tell me, okay, you didn't said it. Pushing your own agenda. Tell me, how would you encourage a client who struggles to find their voice and they just want to be told what to do? Jazz, tell me what to do. How can you help them find their voice and not necessarily feel like they can't have a voice and that they have to be told what to do?
Absolutely. I chuckle because I've had plenty of clients come in and say that. What would Jazz do? The way in which I support them would be knowing that you are the expert of your own life. Even if you were to look at what Jazz Rael thinks you should do, at the end of the day, me making decisions for you, you have to be the one that has the consequences of those decisions, the experiences of those decisions. It has to be you to live out your life, and I'm not able to do that for you. So I want you to be able to walk in your own identity, walk in your own path, and start developing what's in the way of that for you to have that autonomy or that confidence in yourself as well.
So if I hear you right, your role as a cultural humility therapist is that you would be guiding your clients to make their own decisions, that they will find their voice and their way in the work. Now, what about in the context of relationships? Yeah. What would you say about that? So if you're working with a couple and they don't know how to navigate this in their relationship, let's say it's a interracial couple, like how would you engage them to have conversations that might be difficult, that might touch on intersectionality or power or privilege in their relationship?
That's a good question. So one of the things that I've done with clients, couples, we're talking about couples for this example, I have my clients name their what we call social locations. So name certain aspects of their identity, and most of the time is, what is the social location? Why do I have to do this exercise? So being able to get them to name their social locations, name their identities, you already creating a space for a conversation that probably wasn't held before. So maybe I wasn't conscious that this was part of my identity that my partner does not have, or this is an experience that I'm having in that identity I've never talked about with my with my partner, I'm sorry. So I have found that just starting to have the conversation, what's in the way or your barriers to having a conversation? What type of conversations were held in your household when you were growing up? What did you see with your own family origin? And what were messages about certain, whether it's identities, values, worldview, that was being held as well? So those are some of the ways I would do it to start to support them with having a conversation, and then supporting them with what are some things that you're uncomfortable about? Like, what are some barriers to having that conversation?
Yeah.
Such a good question.
Do you find with your couples that there's one particular partner who might talk more than the other? Like, how do you balance out their communication if one partner like speaks a whole lot more and the other partner is like more quiet and they might be fearful to like speak out about these things?
That's a good question. I feel like some of the questions, like there's so much I can say there, so many layers.
On, Jazz.
So
Say it
many
all.
layers in therapy.
Say it all.
I think one of the ways, one, I'm going to be observing the way in which I see that somebody speaking more than the other, or creating this space for them to take turns speaking. I've done things in the past where I might have said to them, we're each going to have X amount of time to talk. Or if I'm seeing that somebody's uncomfortable with that because they're used to their partner speaking for them, or they're used to whomever having the floor, how can we support you with knowing that your voice is just as important in this space as your partner's voice is, and showing them the way in which I think that's the only way change can actually even come about, is that both of you being able to advocate for yourself, to be able to share different experiences that you're having within this relationship, and conflicts and communication as well.
Okay. What do you think about? So I know you also mentioned that you see individuals, and when you're working with individuals in the context of relational work, how do you get them to speak about their intersectionality when it's just them by themselves?
That's a really good question. So I'll go back to that same social location activity. I've done that with so many clients, being able to just, again, start that conversation, explain why I'm having the conversation, and then having them be able to identify. I've done things like, each of these identities you're describing, which way do you feel power in this identity, or which way do you feel privilege, and then which way do you not? So just having them to start having the conversations, and then because I am a marriage and family therapist, I'm very systemic and relational. I know we might have to get to what those terms mean, but I'm going to ask them, what does that look like for them in the context of their relationships as well? Like, what does it look like to have this identity at home, or with your partner, or with your family of origin as well?
Well, since you already took it there, so let's go back for a second. And what exactly is social location for those who do not know at home what that is?
Absolutely. So social location is being able to, I was going to say locate, being able to identify and locate your different identities within your own self. Like, what are the identities that define you? And there's several of them. And most of the time, people don't realize the first identities they describe are the ones that's most prevalent for them. And then after I say that, that's like a light bulb moment for a lot of people. Those first at least 3 identities you share are the ones that's most prevalent for you on a day-to-day basis. And then the conversation just starts from there as well.
Okay. So if I was to socially locate myself, I would say I'm an African American woman, born and raised in Philadelphia, and currently I sit in this space at LaSalle University as the program director. And someone who isn't in this role would probably locate themselves in a different situation. Now, you also mentioned systemic, and so people use systemic a lot, but do people know what systemic really is? So let's go there. Like, what exactly is a systemic therapist? Like, what does a systemic therapist actually do?
Yeah, I would say, a systemic therapist is a therapist in which they're really looking at someone in the context of their relationships, being able to, I'm using the word relational, being
Right,
able
we
to,
have a relationship, right?
yes, we do. There is a relationship right now. Being able to identify or support someone with seeing themselves in the context of their relationships, why that's important, see themselves in the bigger context of bigger systems in place as well, culture, particularly society, and why that's important for them. So not just seeing a person as just a person, but everything that makes them who they are, all the different systems that creates with them who they are.
Sure. I think sometimes when people think about systemic work, they just think about like romantic relationships. What other relationships would you say that could be very, very systemic?
Oh, that's such a good question. Siblings is a relationship that I see all the time.
Let's not even go there about siblings, but
sibling relationships, friendship relationships, the relationship between parents and children. Oh my goodness. Relationships with bosses at work, co-workers at work. So many different relationships that I can see that are not just intimate. I think that you used the word intimate. Not just intimate relationships, for sure.
like platonic.
Yes, which are very important. And a lot of times, I'm glad you asked that question, because when I say I do relational work, people just automatically think I'm just talking about partner work or just intimate relationships. And there's so many other relationships that's extremely important, and they impact us on a day-to-day basis.
Yeah. I wanted to leave a little bit time for you to be able to tell people a little bit about your private practice.
Okay.
I know we're like almost wrapping up. It went by so
Okay.
fast.
It did.
But let's give people an opportunity to learn a little bit about your practice. Where can they find your practice?
Absolutely.
Let's hear a little bit about that.
Sure. So my practice is called
And what does it specialize in first?
Sure, absolutely. My practice is called It's Just Your Crown Healing Center. So my practice, in which it specifically focuses on the young Black woman experience, Black mental health, in particular. I'm saying young Black women, but I've had women from all walks of life call me. Not even just Black women, not even just women-identified individuals either. But my practice, if someone was to go look me up, they would see the Black female identity. They will also see, we're talking about cultural humility. I work with other therapists around cultural humility, not just using the term cultural competency. So I do consultation within my private practice. I do supervision within my private practice. So I work with other therapists a lot in my practice, and I see the clients I work with as well.
Okay. And so while you're teaching here at LaSalle University, can you share what are your major classes that you teach here so that if anyone should ever find their way here, which class would they find you teaching?
Oh, so my favorite classes, we're talking about systems work. I teach introduction to systems and system counseling or therapy. That's one of my main ones. Multicultural counseling probably should be number one because we're talking about that now. That's another one. Oh, there's so many. I would say those are the main two, because especially because of the topic we're talking about, that those are the main two. I teach several classes, but those are the ones in which I'm able to talk about what it is to be a systemic therapist and what does it mean to have cultural humility and working as a therapist. All of that goes into all of my classes, but those two, the titles specifically are about those particular classes.
Thank you, Professor Turner.
Sure.
Is there any final thoughts that you would like to wrap up with before we wrap up for today?
I think one of the final thoughts I would have is just, again, clients being able to have and know that they have a right to be who they are and show up who they are as therapy. And that if a therapist is not allowing them to be safe, my hope is that clients can advocate for themselves and share they're not feeling safe. And if not, they know that there are other therapists that they can turn to as well, because they should be able to be who they are in therapy at all times.
Thank you, Professor Turner. Well, I am April Lancet, licensed marriage and family therapist, program director for marriage and family therapy. You learned a little bit about Professor Turner, who is one of our teaching faculty here at LaSalle University. I thank you for tuning in to our second episode of our revival show, and have a good evening and be well.